Dr. Margaret Carran. She is Associate Professor in Law and Associate Dean for Education at the City Law School, University of London, UK. And she'll be talking about the gambling and problem gambling monitoring methods in the United Union, in the European Union member states. So we're extending the scope from the domestic view on Cyprus to Europe. And I think that's a wonderful combination. Both will discuss their findings and their analysis in the fireside chat immediately right after. May I ask Dr. Carran to join me on the panel? Here you are. Thank you very much. Looking forward to your insights.
Thank you very much for this wonderful presentation. I'm going to put it away, although I'm not sure whether the echo disappears. But I don't think the echo is there. I think the echo is here. I think that's what it feels like. Thank you very much for the presentation. As I was introduced, I'm Dr. Carran from University of London, City University of London. And what I'm going to present to you today is a snapshot on some of the findings that I have discovered doing my study that I carried out in conjunction with the European Gaming and Betting Association. What we really wanted to do in terms of the actual study was to find out what European Union jurisdictions actually do in terms of how do they measure problem gambling, how do they measure gambling engagement, and what happens to those details afterwards. What we didn't want to do, and this is still not the case, is to call out on any country in order to name or shame or to cause anything of that kind. It was simply a fact-finding exercise to find out whether any of the measurements method can be compared with the other in order to see to what extent this can be used to assess the evaluation of effectiveness of any regulatory measure that takes place. So when we kind of started on it, and we started during COVID, we hoped we were going to get answer from most of the European Union jurisdictions. We didn't, but we have managed to get a good snapshot from quite a lot of them. Now, in terms of the methodology very quickly, we sent a survey to relevant regulators or national ministry, depending on the jurisdiction, asking specific questions as to how gambling engagement is measured, how problem gambling is measured. We also had additional questions to ask whether member states had specific definition of problem gambling. And we also asked whether the member state had specific definition of gambling harms. And this is important because we made the distinctions, I've made the distinctions between problem gambling as being assessed by most of the surveys through the screening tools and gambling harms that tend to be potentially significantly broader and more extensive than it would be the case with the problem gambling itself. We got the surveys from some of the jurisdictions. We then asked some of the national association if they could supplement those. In total, we received 20 surveys. Today, I have picked up 16 of them to look at, and we've made the analysis that is the current presentation for you. In terms of acknowledgement, limitation, and disclosure, very briefly, the EGBA was the one that commissioned the study. They fully funded it, and they helped with the conduct of the survey as to who they were sent to. However, after that, they had almost no involvement, and all the analysis and the discussions was done by myself. And apart from the commission's fee, I don't have any other conflict of interest to disclose. Okay, before we started upon it, we'll look at some of the surveys and the scoping study that were carried out before. So there were especially two that looked at what has already happened. So Williams et al. Has already been cited by Matthew in 2012. He looked at what kind of national surveys were carried out in different jurisdictions. and he identified 19 in the relevant countries. As you can see, I removed UK because UK is no longer part of the European Union, although we have looked at what UK does in this context as well. For the same period of time, from 2000 to 2015, we also had Calado and Griffiths, who carried out the same study, and it can already show how different it is. Williams et al. Has identified 19 studies, Calado and Griffiths have identified 31 studies. And importantly, Williams et al. Carried out standardization exercise, and those are numbers for European countries. Williams did internationally worldwide, but I removed the countries that were not part of the European Union. Whereas Calado and Griffiths simply looked at what happened without standardization exercise. Now, what is the standardization exercise that I'm referring to is simply trying to play with the figures and work with the figures to make them comparable internationally. And it was quite interesting to see that Matthew Young mentions that Cyprus has done the first survey that can be compared internationally, because this is precisely what I'm trying to drive at in my presentations after looking at what's currently happening in European jurisdiction. So what we have found, I looked at responses from 16 member states. In total, we got 20, but those 20 includes United Kingdom, which of course is outside EU now, and I also was able to gather the data from Ireland myself, and we had responses from France, but not from the regulators, but from the French National Association, and we had 2 other responses which were partial, so I was able to include them in the final report, partially but not in full. So what we have found that it's interesting. Well, the first interesting part, and it's probably a credit to Cyprus, is that Cyprus is the one jurisdiction that requires carrying out of national systematic surveys in its law. All the other countries carry it out on a regular basis, but it's not statutory mandated. It's probably required from the regulatory point of view, but not in a primary legislation. In terms of the other countries, what is important to note is that all countries carry out surveys, one way or another. But we made a clear distinction between those that are systematic and nationally driven, and those that are perhaps less systematic, more ad hoc, or not prescribed by the regulators, but carried out by different actors. So we had a reasonable equal split. If I include the additional 4 countries, then we would have 12 who carry out national surveys in a systematic manner, and 8 who measure gambling engagements in a different way. Now, the fact that we have lots of national surveys carried out is where similarities end. And it's interesting to hear Mr. Young saying before that Cyprus also had national surveys beforehand, which we know, of course, but this survey that was carried out 2022 was the one that could have been compared internationally. And this is what shows, and I will try to show in a second, at the moment is very difficult. You can find specific jurisdictions that will fit within the timing, within the methodology, within the vehicle, that you can compare your findings to the others, but to make it in a consistent way across many jurisdictions, for example, within European Union, is almost impossible. And why is it impossible at the moment? The reasons why it is impossible is because of the first thing, varied intervals. So the intervals of how these surveys are carried out can be as little as quarterly telephone surveys that take place by the Gambling Commission in UK, to 5 years, which take place in Austria and Denmark. Now, we have lots of intervals in between. So some countries have intervals of 1 year. They do it every year. Some countries do it every 2nd year. Some countries do it every 3 years. Some countries do it every 5 years. And they don't do it at the same time. So it's not only that the intervals differ, but also the actual durations and when those data is being collected differ as well. Secondly, it's not only that the intervals are different, but we also have different target groups as to who is being surveyed. Again, if we would think that every country is targeting the same type of people, that's not correct. Some have a minimum age that starts at 15. In some countries, the minimum age of people who are included in the adult survey, not in the kids survey, is 16. In some, is 18. In some countries, for example, Malta or Italy, there is no upper limit. So we can have anyone included in the survey. There is a minimum limit, no upper limit. In other countries, we have 74 maximum age, 65, 75. Again, very significant difference in the age groups. What's more is that we have varied vehicles. So in some countries, we have bespoke population-based gambling surveys. In some countries, we have national household surveys. In others, we have health surveys. In some other countries, we also have bespoke measures which utilize their own specific vehicles that they have chosen. So those things make huge differentiations in the outcomes. And that is because we know that different target groups, different vehicles, and different timings will produce different outcomes with regards to the number of people who engaged in gambling and the number of problematic gambling behaviors. Additionally, it doesn't stay still. Those things remain in flux. Only Cyprus, Finland, and Malta had a system that have been relatively unchanged for quite some time, but even now Cyprus have changed the measure. So that leaves Finland and Malta that allows for the comparisons to be made over a prolonged period of time. When it comes to other jurisdictions that do not have a systematic intervals, it doesn't mean they don't have surveys. In fact, Belgium, for example, is one of them. They have more surveys carried out than many of the countries that have reported systematic surveys. But it simply means that they may be more ad hoc. They may be targeting subpopulation as opposed to the general population. And there are some countries, like Portugal, for example, that actually looks at number of players that are registered. And if it looks at problem gambling, it looks through number of players that are on self-exclusion registers. And whether this is a valid measure or not, that remains debatable. When it comes to problem gambling measurements, in terms of the definitions as to what problem gambling means, perhaps unsurprisingly, every country had their own definition. And those definitions were almost invariably referring to either DSM-5 or IDC-11, or previously DSM-4 and IDC-10. Now, they're not statutorily defined necessarily, but this is the common reference point that most of the jurisdictions would have made. However, in terms of the actual screening tools that are being adopted by jurisdiction, again, there is relatively little similarity. The most common one remains PGSI. So this is the one that is authoritative and it's used in the vast majority of member states, but not everywhere. So we have other surveys, that refer to other measures, such as SOCs, notes, lie and bet screening tools. And again, we know that different screening tools will produce different outcomes. And when it comes to official gambling-related harms, only Finland has partial statutory definition of what is included. But again, the definitions that it's statutory is very broad and doesn't necessarily go into the details that are perhaps important. Now, it is, of course, important to note that health professionals and all people who relate and work in this industry are very aware of what gambling-related harms are. But there is a bit of a gap between awareness of what they are and clear articulation of those for the purpose of measurement, and to see whether there is any scope in which those gambling-related harms can be measured objectively. So what this brings me to and why it matters, and I appreciate that I'm running out of time, so I've run out of time, so I will wrap it up in less than 1 minute. Why it matters? To me, it matters because many of you who may have heard me before, I'm a very avid advocate of standardization and trying to harmonize the rules that can be harmonized as much as possible. And there are 2 reasons behind my kind of desire to do it. The first one is we keep saying that we want to introduce safer gambling measures, that we want to introduce social responsibility measures that are proportionate to the risk, that are protecting the players and do not make it impossible for the industry to operate. But how are we supposed to know which of those measures truly work if it's very difficult to assess it based on the surveys that we carry out? If we keep changing the focus of the surveys, if we keep changing the methodology, if we keep changing how we decide whether people are at risk or not at risk of problem gambling, what is the real evidence that we have that specific regulatory interventions do or do not work? Secondly, any issues with regards to enforcement and comparisons between the countries, again, if we have different duration, different times, different screenings, makes it very hard. Standardization exercises are time-consuming and very expensive, and they are not carried out very often. If we had a significantly more systemic way of doing things that is comparable internationally across many jurisdictions over a period of time, it would produce a genuine evidence of what regulatory interventions do and do not work. Thank you very much.